So I'm going to talk a little bit about breast implants today and the effects of breast implants. So breast implants are essentially made of a silicone shell, so a silicone coating, and inside is a sort of semi-solid silicone that's a bit like a jelly baby. So if you cut into it, the silicone doesn't leak out, it just sort of stays there as a jelly mess. So a lot of patients get worried about the safety of breast implants, and they've been around for a very long time, since the 60s. We have a lot of very good safety data on breast implants, and they are safe, and we know they're safe. There are some downsides to having a breast implant, and it's always important that you know what the downsides are of the implants. It's clearly not a natural piece of tissue. So when you put it inside the body, your body forms a scar around that breast implant. And over time, that scar tends to tighten. So over time, the breast implants will change shape a little bit. They'll harden, deform, and that's why over time, you might need your breast implants replacing, not because they're ruptured, but just because they get a little bit harder over time. There are occasional problems with implant rupture. Some companies in the past have made very low quality implants, particularly the French PIP implants, which did rupture, but the modern implants that are used in the NHS practice have a really good safety record of 25 to 30 years. Other problems with breast implants can be that there is a tiny risk of breast implant associated lymphoma. So around about 1 in 80,000 breast implants will cause a lymphoma in the breast. This essentially, usually for most women, for about 4 out of 5 of those women, is just some fluid around the implant that has some inflammatory cells in it. So if you have a breast implant in for reconstruction or augmentation, you may notice that suddenly the implant swells every few weeks. That can be a sign of a lymphoma developing, and you need to get it checked out. For 4 out of 5 women who develop an early lymphoma, you just need removal of the implant and potentially a new one putting in if you needed to. For 1 in 5 of those women, so about 1 in 400,000 women, they may need other treatments like chemotherapy and radiotherapy, so it's very rare. So if we compare the risk of breast cancer, which is about 1 in 7 to 1 in 9, the risk of a lymphoma is approximately 1 in 400,000 that would cause you harm. So on that basis, they're very safe.